Now, living well with LDS Hospital.
Emily and I were just chatting in the break saying this is such a great topic. I'm so glad we're talking about this on a Monday. Dr. Ted Wander is here. He's from LDS Hospital. Of course, it's our Living Well segment, but he is the inpatient psychiatry medical director. And we said, come on the show because so many of our viewers out there are facing nervousness and anxiety. I mean, maybe you're going to be on TV that day. Maybe you have a speech. Maybe you have a test. How do you know which is which and which is more serious?
All humans suffer from anxiety at times. It's just a normal human emotion. But when the anxiety is persistent or causes life changes, changes in the ability to function and go to work and have relationships, then it becomes a problem.
I love this. Anxiety is different from person to person, but one major symptom, persistence or severe fear or worry, where most people would not feel threatened, that's where the real problem comes about. So talk to us about what you meant by that, because I thought reading through the material you sent over, that's what really stuck with me, is that for some people, this might seem like it shouldn't be a problem, but it most definitely is.
Right. There are two main kinds of anxiety disorders. One, generalized anxiety disorder, much like you were just talking about, persistent worry, accompanied by fatigue, insomnia, difficulty concentrating. And then there's another main kind of anxiety disorder, panic attacks and panic disorder.
So we have the symptoms right now of panic attacks up on the screen. We just had the symptoms for anxiety. How are the two different? Does this come on all of a sudden and anxiety is pretty consistent?
Yes. Panic attacks come on and last anywhere from several minutes to an hour and are accompanied by a number of physical symptoms. And these attacks are discrete and they're very frightening and very disturbing. Generalized anxiety is more a persistent state of worry. Both can leave a person really affected by it and in need of treatment.
Let's go back to the panic attacks. For a lot of people, this might be their first time, because you know this can happen kind of at any point.
Right.
What should a person do in that moment if they feel like something is happening, this isn't normal, I have these overcome feelings like we listed on the screen? In that moment, what can you do to make yourself feel better and to get help?
Right. I think trying to stay calm, which is difficult in the midst of
You don't want to hear that when you're in the middle of that.
Right. Trying to wait it out because it won't last longer than an hour. And then looking at what one might need to do to get it evaluated and treated. Folks who have both of these anxiety entities need to be evaluated medically, to have a good physical by their primary care physician, usually some labs to make sure that there isn't something non-psychiatric going on.
Dr. Wander, do you find that people suffer in silence, that this is somehow embarrassing, that you don't want to say it out loud, and maybe we don't know exactly how many people are suffering because we're not talking about it?
Yes, exactly. It's an embarrassing and a confusing thing that happens. Statistics tell us that up to a third of individuals, so a third of all of us, will have one panic attack at least during our lifetime. Now that doesn't mean anywhere near that number will go on to develop panic disorder. Probably that number is more like 3 to 5% over a person's lifetime. But yes, even a third of people will have a panic attack once in their lifetime.
Okay, so we know that a lot of people deal with this. It's nothing to be embarrassed about. What is one thing you can share with our viewers that if they institute in their daily lives when they feel nervous or stressed, that could make a difference and help them to calm down in a way that is beneficial for them?
Yes, well, healthy lifestyle, getting enough sleep, having good relationships, eating well, exercising regularly helps all things such as anxiety or depression. So that's a great place to start.
I like the sleep, because if you're tired or you're hungry, you can't think straight.
Nothing is good. Nothing turns out.
Right.
If you have more questions, LDS Hospital has the answers for you. If you want to know about services for anxiety disorders, maybe it's time you see a doctor. LDS Hospital Behavioral Health Services, the phone number on your screen, and we can also link you to all of their information and their website. Dr. Wander, thank you so much.
Such a great segment. Thank you very, very much. Okay, coming